It starts subtly, a little tickle, a slight burning sensation. You try to ignore it, but the urge to scratch becomes overwhelming. Vaginal itching is a common and often frustrating problem for women of all ages. It can disrupt your day, interfere with intimacy, and leave you feeling uncomfortable in your own skin. The good news is that most causes of vaginal itching are easily treatable. However, it's important to understand the difference between vaginal itching and vulvar itching, as well as the potential causes, to get the right treatment. While often used interchangeably, vaginal itching and vulvar itching are not the same. Vaginal itching refers to irritation inside the vagina, the internal canal that connects the cervix to the outside of the body. Vulvar itching, on the other hand, refers to irritation of the vulva, the external female genitalia that includes the labia, clitoris, and vaginal opening. Understanding the location of the itch can help your doctor determine the underlying cause. For instance, vaginal itching is more commonly associated with infections like yeast infections or bacterial vaginosis, while vulvar itching might be caused by irritants, allergies, or skin conditions. One of the most common causes of vaginal itching is a yeast infection. Yeast infections occur when there is an overgrowth of Candida, a type of fungus that normally lives in the vagina in small numbers. This overgrowth can be triggered by various factors, including antibiotic use, hormonal changes, and a weakened immune system. Along with intense itching, yeast infections are often accompanied by a thick, white, cottage cheese-like discharge and a burning sensation during urination or intercourse. Fortunately, yeast infections are easily treated with over-the-counter or prescription antifungal medications. Bacterial vaginosis, or BV, is another common cause of vaginal itching. Unlike a yeast infection, which is caused by a fungus, BV occurs when there is an imbalance of naturally occurring bacteria in the vagina. This imbalance can be caused by douching, having multiple sexual partners, or even just having a new sexual partner. BV is characterized by a thin, grayish-white or yellowish discharge with a strong fishy odor, which might be more noticeable after sex. While not all women with BV experience itching, it is a common symptom. Treatment for BV typically involves a course of antibiotics. Section 5. Irritants and allergies, the usual suspects. Sometimes the culprit behind vaginal itching isn't an infection, but rather an irritation or allergic reaction. Everyday products like soaps, detergents, feminine hygiene products, bubble baths, and even certain types of underwear can irritate the sensitive skin of the vulva. Allergic reactions to ingredients in these products, such as fragrances, dyes, and preservatives, can also cause itching. If you suspect an irritant or allergy, switching to hypoallergenic, fragrance-free products and avoiding douching can provide relief. Section 6. Other causes of vaginal itching, STIs, menopause, and more. While yeast infections, bacterial vaginosis, and irritants are the most common causes of vaginal itching, several other conditions can also be responsible. It's important to understand these less common causes to ensure proper diagnosis and treatment. Sexually transmitted infections, or STIs, like trichomoniasis, chlamydia, and gonorrhea, can cause vaginal itching, often accompanied by other symptoms like unusual discharge, pain during urination, or pelvic pain. These infections are typically spread through sexual contact and can have serious health implications if left untreated. Regular screenings and practicing safe sex are crucial in preventing and managing STIs. Menopause, with its accompanying hormonal changes, can lead to vaginal dryness and thinning of the vaginal walls, making the vagina more prone to irritation and itching. This condition, known as atrophic vaginitis, can significantly impact a woman's quality of life. Hormone replacement therapy and vaginal moisturizers are often recommended to alleviate these symptoms. It's essential for women going through menopause to discuss these changes with their healthcare provider to find the best management strategies. Additionally, skin conditions like eczema, psoriasis, and lichen sclerosis can also affect the vulva and cause itching. These conditions are often chronic and require ongoing management. Topical steroids and other medications can help control the symptoms. It's important for individuals with these skin conditions to work closely with a dermatologist to develop an effective treatment plan. Understanding the underlying cause of vaginal itching is key to finding relief and preventing further complications. Keeping a detailed record of symptoms, including their frequency, duration, and any associated factors, can be incredibly helpful for healthcare providers in diagnosing the cause of vaginal itching. This information can guide the selection of appropriate tests and treatments, ensuring a more targeted and effective approach to care. Support groups and online communities can also be valuable resources for individuals experiencing vaginal itching. Sharing experiences and advice with others who are going through similar issues can provide emotional support and practical tips for managing symptoms. Remember, you are not alone, and there are many resources available to help you navigate these challenges. Section 7. Home remedies and self-care tips. Finding relief. While it's essential to consult a doctor for a proper diagnosis and treatment plan, several home remedies and self-care tips can help soothe vaginal itching and prevent future occurrences. Consulting with a healthcare professional ensures that you are addressing the root cause of the issue, and not just the symptoms. However, in the meantime, there are practical steps you can take at home to find relief and maintain your comfort. Keeping the area clean and dry is crucial. After showering or bathing, make sure to gently pat the area dry with a soft towel. Moisture can create an environment where bacteria and yeast thrive, so maintaining dryness is key to preventing irritation and infections. Gently wash the vulva with warm water and mild unscented soap, avoiding harsh scrubbing. Harsh soaps and vigorous scrubbing can strip away the natural oils and disrupt the delicate balance of the vaginal flora, leading to further irritation. Opt for products specifically designed for sensitive skin and intimate areas. Wear breathable cotton underwear and loose-fitting clothing to allow for air circulation. Tight clothing and synthetic fabrics can trap moisture and heat, creating a breeding ground for bacteria and yeast. Cotton is a natural, breathable fabric that helps keep the area dry and comfortable. Avoid douching, as it disrupts the natural balance of bacteria in the vagina. Douching can wash away the good bacteria that help keep the vaginal environment healthy, leading to an imbalance that can cause infections and irritation. Instead, let your body maintain its natural balance. Applying a cool compress or taking a warm bath with plain unscented oatmeal can also provide temporary relief from itching. The cool compress can help reduce inflammation and numb the area, while an oatmeal bath can soothe the skin and reduce irritation. Make sure the oatmeal is plain and unscented to avoid any additional irritation from fragrances or additives. Staying hydrated and maintaining a balanced diet can also support overall vaginal health. Drinking plenty of water helps flush out toxins from your body, and a diet rich in fruits, vegetables, and whole grains provides essential nutrients that support your immune system and overall health. Incorporating stress-reducing activities like yoga or meditation can also be beneficial. Stress can impact your immune system and overall health, so finding ways to relax and manage stress can help maintain your body's natural balance and prevent issues like vaginal itching. By following these home remedies and self-care tips, you can find relief from vaginal itching and support your overall vaginal health. Remember, it's always best to consult with a healthcare professional for personalized advice and treatment. Section 8. When to see a doctor. Recognizing warning signs. While most cases of vaginal itching are not serious, it's important to know when to see a doctor. Vaginal itching can be caused by a variety of factors, including infections, allergies, and irritants. Understanding the underlying cause is crucial for effective treatment. If you experience severe itching, unusual discharge, bleeding, sores, or blisters, these could be signs of an infection or other medical condition that needs attention. Blisters and pelvic pain can be particularly concerning, as they may indicate a sexually transmitted infection or other serious health issue. Pain during urination or intercourse is another red flag. These symptoms should not be ignored, as they can be indicative of conditions like urinary tract infections, pelvic inflammatory disease, or even endometriosis. These symptoms could indicate a more serious condition that requires medical attention. Early diagnosis and treatment can prevent complications and improve outcomes. Additionally, if your symptoms don't improve with home remedies or over-the-counter treatments, it's a sign that you need professional medical advice. Home remedies can sometimes provide temporary relief, but they may not address the root cause of the problem. If your symptoms recur frequently, it's essential to seek professional medical advice. Recurrent symptoms can be a sign of an underlying condition that needs to be properly diagnosed and treated. Your doctor can perform a pelvic exam to check for any abnormalities. This exam can help identify issues such as infections, cysts, or other conditions that may be causing your symptoms. They may also take a swab of vaginal discharge for testing. This can help determine if there is an infection and what type of infection it is, so that the appropriate treatment can be prescribed. Your doctor will then recommend the most appropriate treatment based on the underlying cause. This may include prescription medications, lifestyle changes, or other interventions to help alleviate your symptoms and address the root cause of the problem. Remember, taking prompt action when you notice warning signs can make a significant difference in your health and well-being. Don't hesitate to reach out to your healthcare provider if you have any concerns. Your health is important, and recognizing the warning signs early can help you get the care you need to stay healthy and feel your best. Section 9. Taking control of your vaginal health. Knowledge is power. Vaginal itching can be uncomfortable and distressing, but with the right information and care, it's manageable. Understanding the potential causes, practicing good hygiene, and seeking medical attention when necessary can empower you to take control of your vaginal health. Remember, you are your own best advocate for your health. Don't hesitate to talk to your doctor about any concerns you have regarding your vaginal health.